Opioid addiction is sweeping across Oregon and the rest of the country, of course. According to the CDC, though, more Oregon seniors end up in the hospital because of problems with opioids than anywhere else in the country. KGW's Art Edwards joins us live from Southwest Portland. And Art, that fact certainly caught Oregon doctors by surprise.
Yeah, it certainly did. They are aware, of course, that there is a problem. They just didn't expect what they heard from the CDC in that report. There is a state task force that has been in place that came up with some new guidelines for prescribing opioids. It has helped, but there is still a long way to go.
We know a lot of people have chronic pain. It's almost 1 in 5 adult Oregonians say they have chronic pain.
In the past, they've been treated with opioids. An Oregon task force on the drugs reported that in 2014, enough opioids were prescribed in Oregon for nearly every person in the state to have a bottle.
For treating chronic pain, they really don't work very well, and people get tolerant to them or become addicted, if you will, and then that increases the risk of respiratory suppression, and people can both be hospitalized and they can die from them.
A report from the Centers for Disease Control released this week showed that the number of prescriptions for opioids have gone down by 20% from 2010 to 2015, but concluded that far too many people are still on the drugs. The opioid epidemic hits close to home. According to the CDC report, Oregonians 65 and older end up in the hospital for overdoses, abuse, dependence, and other negative effects at a higher rate than any other state.
When you're treating elderly people, you want to keep them functional, and you want to resolve their pain too, or at least treat their pain. But you have to be really careful and realize that medications are only one part of the puzzle, and they may not even be a part of the puzzle for every patient.
Now doctors are looking at alternatives.
It works very well to be using a variety of treatments like physical therapy, occupational therapy, things like acupuncture or yoga, chiropractic. There are a number of things that can be used to be addressed, or over-the-counter pain medication.
Now, the CDC has some guidelines of its own. They say that painkillers should never be taken for long-term conditions like arthritis or back pain, and they should only be used cautiously for acute pain from things like surgery or late-stage cancer.